was the year 2000. I was at work. I had a really bad sinus infection, ear infection, and took a nap at lunch and woke up in an ambulance. I was nervous, I was scared, I didn't have any idea why I was in an ambulance, and then my family was with me and kind of calmed me down and told me I had a seizure, and I just didn't understand because I never had one in my life.
I've known Karen for several years. When she first came to me, she described her epilepsy and also some frustration that she's seen multiple physicians who really could not help her with regards to her seizure control. We would get a call every few weeks. She would have a fever, and then she'd call in and say she had another seizure.
First few years, they were all in my sleep, grand mal, but after that, I started having the ones where I was awake and I would space out for about a minute or two. I would still be sitting like in the same position I'm in now, and I would just quit talking. I would just kind of look around, and they said that I was always kind of moving my fingers a little bit and kind of like, I guess, licking my lips. And they said no matter what I did, they couldn't get me to talk to them or answer them. And then all of a sudden I would come back and I'd just say, okay, I just had a seizure, I know. I'd go back working like as if nothing happened. I didn't think I had an answer. I was always told, nothing you can do. You just have to live with it. And I wasn't giving up. I just fought and said, I can't let it take the best of me. You have to live your life and hope and pray that one day you get an answer. And a lot of people tell me, how do you get up every day and go to work? You know, I said, well, you can't give up. You have to keep fighting.
So as it pertains to Karen, she has a rare condition, and the seizures in her case arise from deeper structures in the brain.
The fact that she had two concurrent pathology, being one is heterotopia, which is her being born with some of the cells in her brain not in the right location, as well as what's called mesial temporal sclerosis, which is a common cause for epilepsy. Together, they're fairly rare.
And the option that we decided to use was an approach where we would target those abnormal areas in the brain without having to essentially cut her head open and do a big craniotomy.
We're able to use the combination of both kind of robotic technology and neuronavigation technology to place two small catheters deep in her brain to confirm the location of the epilepsy focus. Once that was determined, we were actually able to place a very, very small fiber optic laser cable down into that location, use laser to ablate the lesions there. Because we're able to access through a 2mm hole, she was able to have this done and go home the next day.
Put your doctor first. Don't just say, oh, they're just trying to give me medicine or they're just trying to do something simple. Sit down and, listen to what they have to say, and you have to put forth effort and you have to put forth a fight to say it's going to improve my life, and said, look, it's a week of being scared and nervous and going through a major surgery, but look at how my life has changed since then. And this may be something that I never have to worry about ever again.